We are the Untouchables, and we did our presentation on ankle inversion sprains and ankle braces.
Our group is comprised mainly of female athletes who play either soccer or lacrosse. Both of these sports have a high incidence of ankle sprains due to the frequent cutting and change of direction that is required. This topic is important to us because the majority of our group has suffered from ankle injuries and continues to have lingering pains because of it. Ankle sprains are a recurring injury within our sport, therefore we want to see if ankle braces are beneficial in preventing this type of injury. Some common factors that influence ankle sprains include fatigue, the surface you are playing on, surrounding muscular ligamentous strength, and the number of previous ankle sprains. The purpose of this project is to determine if ankle braces provide enough support and stability to prevent ankle inversion sprains in athletes who are prone to this type of injury.
The two main tests we used to measure ankle stability were the Star Excursion Balance Test and the BEST test, or the Balance Error Scoring System. Our athlete performed these two tests once with an ankle brace and once without before and after exercise. For the BEST test, the subject had to stand still and close her eyes, keeping her hands on her hips for 3 different positions on 2 different surfaces for a total of 6 trials. First, on a firm surface, our subject stood upright with both feet together on the ground. Then they would progress to a single leg stance with the ankle prone to injury on the ground, followed by a tandem stance with the weak ankle behind the stronger one. This same process would be repeated on a softer surface. In our case, we used 2 pillows to make it harder to balance. Each trial lasted for 20 seconds while the subject tried their best to stand still. The total number of errors that the subject had was their score. The errors considered were lifting their hands off their hips, opening their eyes, stepping, stumbling or falling, moving their hip into more than 30 degrees abduction, lifting their forefoot or heel, and remaining out of a test position for more than 5 seconds. For the Star Excursion Balance Test, our subject stood in the center of 4 different tape lines crossing each other in the middle like the picture shown. With her ankle prone to injury on the ground, in this case her right ankle, she had to reach out with her opposite leg to the anterior, posterior medial, and posterior lateral positions as far as she could reach while staying balanced and keeping her hands on her hips. We measured how far she could reach in each distance 3 times and averaged the score for each direction. To normalize the measurements, we divided by the subject's height. As we mentioned before, these tests were performed before and after exercise to see if fatigue affected the ankle's performance at all. Since our subject is a soccer player, we tried to replicate some light soccer drills that incorporated some cutting and quick movements. To start, we had our subject perform a 10-minute dynamic warm-up followed by a cutting V-shaped pattern that involved volleying a soccer ball, doing 3 sets of 10 reps each side. Next, we had her shuffle 3 to 4 yards side to side, passing the ball with another person, doing 3 sets of 10 reps each side as well. To finish, we had her kick 8 to 10 longer balls to further the impact on the ankle. The entire training lasted about 30 minutes. This same training session was repeated once with a brace and once without a brace on separate days. Immediately after the exercise on both days, the tests described earlier were repeated.
Once we collected all the data from the Star Excursion Balance tests and the BEST tests, we found little difference between the results of the brace and no brace trials. First, looking at the Star Excursion Balance tests, on the day that we dedicated to no brace exercise, the posterior medial direction was slightly improved both with the brace and without the brace post-exercise. The posterior lateral direction decreased slightly with and without the brace post-exercise. This could be due to fatigue of the posterior tib muscles and other ankle stabilizers as a result from the exercise. Increased fatigue will inhibit these muscles from performing optimally under stress, making it harder for the subject to reach as far with the contralateral limb. Oddly enough, the same trend was found on the day that was dedicated to exercise performed with the brace. However, these trends are so subtle that it's clear the brace had little to no effect on the subject's performance in the Star Excursion Balance test. The BEST test also did not show significant variation between the results we gathered. When comparing the pre-exercise tests for both brace and no brace exercise, the subject had 0 errors in all trials on the firm surface. It wasn't until after both bouts of exercise that 1 error in the single leg stance occurred for the firm surface with and without the ankle brace. When looking at the 2 post-exercise graphs, the training the subject performed with a brace did have 1 error less, on the total pillow surface with the brace than on the day where the subject did not wear the brace. Similarly, there were 2 less errors on the total pillow surface without the brace for the post-brace exercise compared to the post-no brace exercise for the same trials. Across all the trials, the total number of errors was higher when the subject was wearing the brace compared to when they were not wearing the brace on the pillow surface. This leads us to believe that the brace actually made it harder for the subject to find stability and balance, possibly because it inhibited ankle inversion and eversion so much that the other muscles and joints had to compensate more for the loss of the movement in the ankle.
After looking at the results of our study, we determined that the ankle brace did not provide as much support and stability as we previously thought it would. In our opinion, the benefits of wearing an ankle brace did not outweigh the cost of buying one. There was little difference seen between the scores from the BESS and SEPS tests when wearing the ankle brace than when the tests were performed without the ankle brace. This leads us to believe that ankle braces are not shown to significantly reduce the occurrence and severity of ankle injuries. Based on research conducted by the Mayo Clinic, internal support from ligaments, muscles, tendons, and bones are what keep your ankles stable and secure, rather than from external support like an ankle brace that is provided, which simply limits certain motions such as plantar flexion and inversion. According to a study done in 2012 that looked specifically at the diagnosis, treatment, and prevention of ankle sprains, exercise therapy was seen to be a major factor in helping to prevent the reoccurrence of injury in people with a history of ankle injuries. These rehab programs are aimed to emphasize improving one's balance, range of motion, strength, and endurance, instead of just buying an ankle brace in the hopes of preventing further injury. It is also important to consider the fact that the more you wear an ankle brace or simply tape your ankles following an injury, the more reliant your body will become on those external applications. If your muscles and ligaments are not having to work as hard because of the external support being provided by an ankle brace, the less strength they will possess because they are not experiencing the same type of strain as they would normally have to in a typical movement.
Based on our research, for patients covered by health insurance, the typical out-of-pocket cost for a doctor-prescribed ankle brace consists of a durable goods copay or coinsurance of 10 to 50%. For patients not covered by health insurance, an ankle brace typically costs about $20 to $200 or more, depending on the severity of the injury and the type of brace needed. If the ankle sprain is severe enough, crutches may be required, which can cost anywhere from $15 to $100. In some cases, physical therapy might also be required to help improve balance, range of motion, and strength, which cost anywhere from $50 to $350 per session. In other words, disadvantaged families may have a harder time finding access to these types of resources and may not be able to afford it even if they are available to them. A cheaper alternative for athletes in these circumstances may be to use athletic tape to tape their ankle rather than purchasing an ankle brace. Ideally, the athlete would be able to perform some type of rehab, even if that is on their own and not with a licensed professional, and eventually strengthen the muscles and ligaments in their ankle to the point where they feel comfortable exercising without any sort of external support. However, if that's not possible, using athletic tape would definitely be the cheaper option for them moving forward. Another solution we discussed as a group was creating a donation drive for used ankle braces and crutches within the sports medicine departments across the ACC. We could do a collection at the end of each sports season when medical professionals tend to analyze their inventory. We could figure out a way to get these items shipped to us and then from there donate them to low-income families or recreational sports programs to donate to younger athletes who may not be able to afford ankle braces or crutches.
Thank you so much for listening to our presentation. We hope you were able to learn more about the effects of ankle braces on ankle inversion sprains in athletes, as well as other alternatives to prevent the reoccurrence of this injury.